Hey everyone, and welcome. So, you're aiming to become an expert-level emergency medicine pharmacist, right? Well, you're in exactly the right place. We're going to pull back the curtain and take you inside the CHRISTUS PGY2 program. We want to show you not just what you'll learn, but how our pretty unique educational model is designed to shape you into a real clinical leader. We'll even walk through a real-world curriculum example to make it all come to life.
Okay, so here's our game plan. First, we'll talk about our vision for what a modern EM pharmacist even is. Then we'll get into our educational philosophy, the how behind everything we do. After that, we'll make it super concrete with a deep dive into our RSI curriculum, show you how it all fits into a typical week, and then, of course, talk about how you can join our team.
So, what do we mean when we say modern emergency medicine pharmacist? Let me tell you, it is so much more than just dispensing medications. It's about being a protector. It's about being a critical thinker who's right there on the front lines in one of the most high-stakes environments in all of medicine.
You know, this quote right here, this is pretty much the heart of our entire program. In the emergency department, you are operating in that critical window, those incredibly intense 15 minutes, where your knowledge, your expertise, can be the one thing that completely changes a patient's outcome.
Let's think about it with an analogy. If the ED team is like a football team and the physician is the quarterback, who are you? Well, you're the offensive line. In all that chaos, you are the one anticipating every threat, seeing every angle, and protecting the patient from harm. That's the expert we're training you to be.
Okay, so how do we actually build that expert? It's not about memorizing a textbook, I can tell you that. We have a very deliberate educational philosophy, a framework that's specifically designed to build true clinical competence and leadership right from the ground up.
It's really a four-step journey we take you on. We start by instructing, building that solid foundation of knowledge. Then we move to modeling, where we show you exactly what expert practice looks like. From there, it's all about coaching you to refine your skills, and finally, facilitating your growth into an independent practitioner who can innovate and lead.
We use adaptive learning to build your knowledge. We model expert behavior from the very first day, and we provide constant coaching to really drive excellence. But ultimately, what we're really doing is fostering a mindset of continuous improvement. Because, look, this isn't just about what you know, it's about who you become as a practitioner.
All right, enough talk about theory, right? Let's see how this whole philosophy actually works in practice. We're going to do a deep dive into one of our core curriculum topics, rapid sequence intubation, or as you know it, RSI.
Okay, so with any topic, we always start with the fundamentals. Before we even talk about a single drug, you have to understand the why, the physiological state we're trying to control. With RSI, the number one goal is to safely and quickly induce profound central nervous system depression. And what's really cool is there are two main ways to get there. Just think of it like a balancing act in the brain. We can either pump the brakes by boosting GABA, which is the main inhibitory neurotransmitter, or we can block the gas pedal by shutting down glutamate, the main excitatory one. In this program, you will become a master at leveraging both of these pathways depending on what your patient needs.
And this is where the rubber meets the road. This is where true clinical decision-making really starts. We're going to teach you a systematic approach to picking an agent, where you learn to weigh every single one of these factors for the unique patient that's right in front of you, from their hemodynamics all the way down to their specific medical conditions.
Which, of course, brings us to the main event, etomate versus ketamine. This is a classic debate in emergency medicine. Here, you're going to dive deep into the evidence, learning how to weigh etomate's rock-solid hemodynamic stability against ketamine's powerful pain-relieving properties. This is what prepares you to defend your choice at the bedside.
In this slide right here, this gets to the absolute core of our program. We don't just feed you dogma or tell you this is the one right answer. No way. We immerse you in the active clinical debates. You'll dig into the evidence behind controversies like etomidate and adrenal suppression, and learn how to critically evaluate that conflicting data to form your own expert clinical judgment.
Okay, let's test this out. Here's a question straight from our curriculum. You've got a patient with a high shock index, 1.2. You decide to induce with ketamine. What's the most likely hemodynamic response you're going to see? This is the level of applied thinking we expect you to master.
The answer? You're actually looking at a blunted response, and even a big risk of hypotension. Now, why is that? Well, a patient in shock has probably burned through their catecholamine stores, which means ketamine's usual supportive effects are going to fail. Recognizing this isn't just some academic exercise. This is the kind of advanced clinical reasoning that literally saves lives.
Okay, so that's the deep learning part. But how does all this theory actually translate into your work week as a resident? Let's take a look at how we intentionally structure your schedule to connect that theory directly to practice.
So here's a look at a couple of sample weeks. Now, the key thing I want you to notice is Wednesday. Wednesday is a dedicated, protected, didactic, and project day. And that is completely intentional. We give you the time to do a really deep dive on a topic like RSI, so that when you walk into your critical care rotation on Thursday, you are 100% ready to apply that knowledge.
You see, it's a completely integrated experience. The deep dive you do on your project day gets immediately applied at the bedside. You get a variety of experiences at different sites. And you'll use tools like our EM topic log to systematically track your progress and make sure you've mastered every core subject by the time you finish the year. All right, let's bring it all home. What does this all mean for you and your future? Are you ready to step up and be a leader in EM pharmacy? Look, this whole structure, our philosophy, our curriculum, that weekly schedule, it's all designed for one purpose: to build pharmacists who don't just react, but who anticipate. Pharmacists who don't just participate in the team, but who lead it. So I'm going to leave you with this question to think about. We've shown you our framework for intentionally connecting that deep, foundational learning with immediate, hands-on practice. Now, you need to ask yourself, how will this kind of training prepare me to confidently handle the most intense 15 minutes of any illness? So, if you're ready to take on that challenge, and if this sounds like the kind of program that will build you into the clinical expert you want to be, then we absolutely want to hear from you. Thank you so much for your time. Here is our program ID for the match, and please, do not hesitate to reach out with any questions you have.